What is AI governance in healthcare? Imagine Dr. Kofi, a doctor in Kumasi, using an AI tool to figure out what's wrong with Amma, his patient. AI can be a game changer, spotting diseases quickly or suggesting treatment. But what if it messes up or unfairly skipped over folks in rural areas? That's where AI governance steps in. It's like the rules of the road for AI, ensuring it's safe, fair, and helpful for everyone. In simple terms, AI governance is the system of rules and processes that guide how AI is built and used in healthcare. It's there to make sure AI is fair, transparent, trustworthy, and accountable, so it works for Ghana's people, not against them. Governance models, keeping AI on track. A great example is the governance model for AI in healthcare, GMAIH, proposed by experts like Reddy and his team. It's built on four key ideas. Think of them as the leg of a steady stool. 1. Fairness. AI shouldn't play favorite. Example, imagine an AI tool checking for malaria. Fairness ensures it works just as well for Kwame in a remote village as for Ajwa in bustling Accra. No matter where you are or who you are, everyone deserves equal care. Simple as that. 2. Transparency. You can see how AI makes its decisions. Example, if Dr. Mensah uses AI to suggest surgery for Amma, you should understand why, like reading a recipe for jollof rice step by step. Clear steps build trust, so no one's left guessing. 3. Trustworthiness. AI has to be reliable, like a good friend. Example, before clinics in Tamale use AI tool, it's tested, like making sure a new trotro won't break down on the road. 4. Accountability. Someone's responsible if AI slips up. If an AI misses something in Kwame's diagnosis, there's a plan to figure out who fixes it. Maybe the developers or the hospital. No one should shrug or say, oh well. This model acts like a safety net, catching problems before they hit patients across Ghana. Governance framework, the building blocks. Now let's talk about the conceptual framework, the pillars that hold AI governance up strong and steady. 1. Validation and evaluation. Testing AI to make sure it's spot on. Example, before an AI spots tuberculosis in whole, it's checked against real cases like tasting soup before serving it. 2. Regulation, legislation, and ethics. Rules to keep AI safe and respectful. Example, Ghana could make laws so Ama's health data isn't misused, and she agrees to how it's used. Protects privacy and keeps things fair. 3. Auditing and quality assurance. Regular checkups on AI's performance. Example, every few months, the AI in Kumasi hospitals get a review to spot glitches or biases. 4. Training of staff. Teaching healthcare workers how to use AI. Dr. Kofi goes to a workshop in Accra to learn how AI can help his patients. 5. Public and patient involvement. Asking people what they think. Before a new AI app hits Tamale, nurses and patients test it and share feedback. AI could change healthcare here, helping Dr. Mensah speed up diagnosis or letting Ajwa track your diabetes at home. But without governance, it's like driving without brakes. Models like GMA, IH, and frameworks with strong pillars ensure AI fits Ghana's needs, respects our values, and serves everyone from Accra's busy streets to quiet villages. So next time you hear about AI in healthcare, Think of it as a helpful tool with wise rules, like a good driver with a map, getting us all better health safely. You are listening to Zared Podcast.